Thank you for joining Spine Time. Dr. Singh, please go ahead and get started.
All right, welcome everyone. I see people are slowly trickling in. We'll get started just in a few moments. Exciting topic today, very timely. I'm talking about winter sports. All right, we'll give it 30 more seconds and then we will get started. Dr. McGrath, you're here?
I'm here.
All right,
happy to be here, Rick.
Wonderful, wonderful.
Talking about my favorite thing. Skiing.
Perfect. All right, let's get started. Welcome, good evening, everyone. Welcome to Spine Time. Today, we're going to be talking about winter sports, how to prevent spine injuries, back injuries, and injuries in general. If this is your first time joining us on Spine Time, please use the chat box, enter your questions. I will be monitoring that throughout the session, and hopefully we will get to all of your questions. We'd like to make it very interactive, so don't be shy. Ask any questions you feel like. So just a little refresher about us. We are the Multidisciplinary Center for Comprehensive Spine Care here at Weill, Cornell, and NewYork-Presbyterian. What we really pride ourselves on is our collaborative and integrative approach to treating patients. If you've seen us here at the Spine Center, you know that we often engage many different specialties for your care, whether it's rehab like myself, or spine surgery like Dr. McGrath, pain medicine, neurology, physical therapy, all of those things. So that's just a little bit about us. I have good news and bad news. The good news is Dr. Lynn McGrath is here to join us. He is an assistant professor of neurological surgery, practicing spine surgery, both here in Manhattan and out at our Queens Ox Spine location. The bad news is that Dr. Roger Hartle is not able to join us. He was called away for another engagement. But the good news is you got me today. So I will be hosting and talking a little bit, but mainly just moderating your questions with Dr. McGrath. So Lynn, take it away. Tell us about winter sports and how to stay healthy.
Thanks, Ricky. And yeah, I was talking about winter sports being my favorite thing. I just spent the past 7 years living in Seattle on the West Coast, and one of my favorite things was getting out in the mountains, going skiing in the winter. I look forward to every winter opportunity to put my kid on my back and go for a cross-country ski, get the dog out, go skiing. So I really love winter sports. I love what they have to offer in terms of just the positive effect it can have on your attitude, being outside, getting sunlight in the wintertime, getting fresh air, especially with COVID, having something that brings you out of the house into the outdoors, I think can have a lot of psychological benefits. Also, a lot of physical benefits. A lot of these winter sports are low impact, so they're not going to beat you up too bad. And a lot of them are walking based. What I mean by that is a lot of them involve just strapping something onto your feet and kind of walking outdoors, either hiking, snowshoeing, like you see in the picture here, cross-country skiing. You're kind of putting skis or snowshoes on your feet and you're just out there walking. And the great thing about walking is that it's low impact, number one. Number two, it's a great workout for your back. Not only is it biomechanically a very favorable activity for your back, but it helps to stretch out all the low back muscles. It helps to strengthen the core stabilizing musculature. So if you're someone that has susceptibility to low back pain, walking can really be an excellent way of warding that off, or of treating it if you currently got it.
Are there, hey, Dr. McGrath, let me ask you, are there certain conditions or patients that you see, sometimes we see patients who say, I feel better when I'm sitting, but when I walk, it really starts hurting. It hurts in my back, it hurts in my legs. Are there certain conditions that may not benefit from even winter-based walking activities?
Yeah, if you're the type of person where you feel like every time you try to walk a block, your legs just feel heavy and you just feel like you're getting too tired more quickly than they should, then that's something that you should get checked out with an MRI and a visit to a spine specialist, because there are some things like lumbar spinal stenosis, which is where the ligaments in the back and the joints in the back have built up with arthritis over time to the point where they are pinching all of the nerves that are trying to pass through the spinal canal and then go out to the legs. That can really get worse with walking, and it's not really going to improve. You're not going to improve that with walking, and so it's kind of like fighting an uphill battle.
The other thing we see a lot in spine care is patients with low bone mineral density. Their bones aren't strong enough. Sometimes that even prevents them from having spine surgery. Where do you see some of these activities playing a role in strengthening some of those elements?
Great for strengthening bones and reducing bone density loss. Actually, my second last bullet point there. Walking, being upright, having gravity weighting the spine, the bones in the spine, putting weight on those bones, that is great for increasing bone density, or at least preventing the loss of bone density. So being upright, walking on uneven terrain, really allowing gravity to kind of weight the spine in the walking position, in the upright position, is really good for people with osteoporosis, people that have a tendency to lose bone density. So great thing for those people. So a lot of benefits: strengthening the core muscles, getting fresh air, psychological benefits, benefits to the health of the bones. But you have to know how to do these things safely. So how do you get out there and do this safely? First, you got to prepare your body. You can't start from scratch and go out there and get on the mountain and start skiing and expect everything to go well. You have to have a little bit of fitness to begin with. So again, I keep hammering on walking. Walking is a great way to prepare yourself for all these different winter sports, because that is the basis for most of the things that we're talking about. Also, core strengthening, just working the core, the hips, the legs, doing planks, doing push-ups, doing little squats, standing squats. All these things will help a lot with the muscles that you need to be able to go out there and be able to maintain your balance and maintain a stable platform while you're out there in the snow and on uneven terrain.
I think what you said is very important. A lot of patients, sometimes they're staying active throughout the fall, but as the winter approaches, most people's activity, at least at home, decreases. But then all of a sudden, they're like, oh, I'm going on a big ski trip, or I'm going out to the West Coast, and they haven't really prepped themselves for those activities. So I think what you said is very important, of really getting your body ready, because, if you're not doing walking-based activities and you do decide to participate in skiing or snowboarding or skating or things like that, it's really important to strengthen those muscles beforehand. So warming up, wearing protective clothing, things like that, so your muscles are not vulnerable when you go from indoors to outdoors. And, I threw this slide in just based on some of the stuff you were saying, doing some light aerobic activity before heading out there. If you're going to do skiing, try some squats. And if you've seen us at the Spine Center, you might have been given one of these ski specific workout regimens that focuses a lot on core and hips and flexibility and things like that. Let me ask you a question, Lynn. Something that we don't talk about, especially when we go from New York City to the West Coast where it's high altitude, how important is hydration? People come out of the airplane and go straight to the slopes. Like, what are some of the deleterious events that can happen in that situation?
Yeah, definitely want to hydrate. I always make this mistake. I get off the plane, I go to the mountain, and the next day I can't get out of bed because I'm so dehydrated that I feel like I got hit by a bus. So trying to drink a liter or two of water every day, staying hydrated, gradually kind of easing your way into activity once you get to altitude. If you land in Denver and then you drive higher up into the mountains, you got to give yourself time to acclimate. And some people respond really well to it. Some people take more time to get used to the altitude. And until you know what kind of a person you are, just take it slow and plan on your first day being a very slow, kind of restful day where you're just gathering yourself, hydrating, getting a good night's sleep. Also, you're going to be jet lagged, maybe on a different time zone, maybe. So focus on getting good sleep, hydrating well, getting a little bit of light physical activity in on your first day, and then easing into whatever it is that you're doing, skiing or whatever it might be.
We've talked on previous Spine Time webinars about spine and wine and how there are some benefits and antioxidant benefits of red wine. But in this situation, how does that impact getting ready for the winter sports? I know people are getting excited for vacation. They land at this resort, they have a glass of wine. What does that really do to your hydration status?
Well, it definitely makes it more difficult to stay hydrated. So you got to weigh the risks and the benefits. I think I'm not going to say don't go out and have a glass of wine. I would just say if you're going to do that, make sure you hydrate it ahead of time. Make sure you hydrate when you get home, and just plan on taking it easy the next day. Don't try and do too much.
The question I get asked a lot, there's that one group of patients that you mentioned who have leg fatigue and heaviness with standing and walking. And yeah, maybe, some of these winter sports aren't ideal for them until they get that evaluated. But what about the patient who's got a disc herniation? They say when I sit, it hurts a lot. Or when I bend forward and put on my pants and shoes, it hurts a lot. Can these patients safely get out there and do some of these winter sports?
Yeah, I think so. I mean, disc herniation is a spectrum. So if you're someone who's got severe sciatic pain, you're going in and getting injections, you're actively managing this. I would say, walking is a great thing. Again, biomechanically, very safe position for the back to be in. So I think walking is great, but you don't want to put yourself in a position where you're going to fall. You don't want to slip a disc and make that, small manageable disc herniation into a big problematic one. So I would say keep it light, keep it to terrain, environments that you're not going to be in danger of slipping on ice. You're not trying to, hike in some kind of a aggressive terrain where you're going to be having to put your feet in all sorts of different positions and contort yourself. You just want to take a nice, gentle hike in the, on the slopes, in the snow, in nature. Nice gentle incline just to get out and get some air and know your limits. Don't try and do too much. But in general, I think walking is great for people with these small disc herniations that are being managed conservatively, and actually can probably help them absorb over time. So
what about moguls? I'm not sure how many people on this webinar today are advanced skiers who are doing black diamonds and moguls, but where do you put what's your opinion on that when one of your patients says, I'm going to do some of these hilly runs?
Yeah, I said, when I turned 35, I stopped doing moguls regularly anyway. I mean, moguls are fun. Especially if there's powder, there's nothing better than kind of floating through a mogul run and feeling like you're a hero. But ultimately, you got to know yourself. If you just had a spine fusion, if you just had a discectomy, I would not be doing moguls. I'd be, getting up early, getting, fresh cord and just making some nice turns and calling it a day. I wouldn't be out there in the moguls.
Let's talk about that for a second, because, we see a lot of patients that come into the center who need surgery, but it's always about, it's elective to some extent, but it's always about timing. I have a trip coming up in April or whenever. Tell me about the difference between a fusion surgery and one of these minimally invasive decompressions like a discectomy. How long do you restrict patients from activity? When do they start therapy, and when can they safely go back to some of these activities?
A huge variety in terms of what people do. I typically will say if you've had a non-instrumented surgery, so no fusion, we just did a laminectomy or we took a small disc herniation out, then probably 3 months after you get that done, you can go out and do some light, safe skiing. I'm just talking about getting out there and doing some easy turns on groomer runs, where you're not in a position where you're going to be falling. If you've had a fusion surgery, I would take that year off completely, and I would just, use the winter to get back into good condition and kind of train for it through the winter and the summer, and try to come back the next year strong. But the last thing you want to do is go out there too early and have a setback, because ultimately the reason why we do these surgeries is to get people back to doing the things they want to do. So just take it slow, give the surgery a chance to work, do it safely, and maximize the chances that you're going to be able to enjoy the benefits of the surgery for the rest of your life, by not going back too soon, and just being dedicated to your prep work and your training and getting in shape and your conditioning, so that the next year you can go, full speed.
When it comes to skiing versus snowboarding, and again, I'm not sure how many people snowboard. I don't snowboard. I also think those days have sunsetted for me. But between skiing and snowboarding, what are your recommendations for patients if they want to do one versus the other? Does one have less impact on the spine, or both about equal?
Yeah, I do both. I think that if you're looking to start a sport, if you don't ski and you don't snowboard, but you want to get out there and you want to start, I'd say skiing is probably easier to start picking up safely without having a bunch of falls. Snowboarding is tough for the first 72 hours. You're going to fall a lot, and they're going to be pretty gnarly falls, because you fall all the way to the ground when you fall on your snowboard. So if you are someone who has a history of a disc herniation, or who has a tendency to low back pain, or to have issues with sciatica, probably skiing is a little bit of a better place to start, because I think for a beginner, it is a little bit less dangerous in terms of just the number of impacts that you can expect to have as you start your way up the learning curve to become an intermediate. That said, if you have knee issues, if you have other issues, I think that snowboarding can be better for someone who's got knee issues, because your feet are kind of locked in, and there's only so much twisting and turning that can be done. So if you really have questions and you're not really sure what to do, you can always come and talk to us and try to get answers to these questions. Consult the experts. If you've got a back injury, if you've got a knee injury, if you've got hip issues, but you really want to get out there and do some of these things, you can never go wrong by coming in and just talking to us and running through a game plan, talking about the risks associated with each of these things, and figuring out what might be the best thing for you to try.
I think what you said was very compelling. The goal of what we do here, for the most part, is to get people back to function and, living their life and doing the things they want to do, albeit safely, and giving your body time to heal. You mentioned earlier that some of these walking-based snow activities like snowshoeing and cross-country skiing were good for bone density. What about the patient who already suffers from low bone mineral density, or something called osteopenia, osteoporosis? Are those patients excluded from winter sports? Is there increased risk of them falling and actually sustaining a fracture?
I think it's like everything else. Anything that's going to put you in harm's way, if you have low bone density, if you have one of these conditions, you are going to be at increased risk of having a problem if you have a fall. And one thing we know about these winter sports is you're on ice, you're on snow, you're on these slippery surfaces. You've got things attached to your feet. So it's not a deal breaker. You just have to, one, either already know what you're doing and know that you can do it safely, or two, pick a winter sport that is safe for your level of ability and your level of bone density. And if that means you have to, restrain yourself and limit yourself to just walking outdoors, listen, there's a lot of benefits to just walking out in the sun, getting some fresh air, spending time with family. And if that's all you feel safe doing, there's still a lot of benefits to that. So, and I think anyone can find a way to do that safely.
Another topic that comes up a lot is something called après skiing, which is my wife's favorite part of skiing. Well, how do people recover? What's the best way to kind of, heal your body after going out and doing some of these various activities? People have hot tubs after skiing or ice. What do you really tell patients to ease some of the soothing the muscles and the joints?
I think the best way is to practice as much as possible so that when it's game time, you're used to it. Actually, in Japan, they have a really interesting culture. In America, everyone goes and drinks after they ski. And they're all dehydrated the next day, and they're not feeling their best when they wake up to go ski the next day. In Japan, it's a much different culture. They have sauna. They have very healthy foods. They have very hydrating meals. So it actually does almost prepare you for your next day of skiing or whatever it is you're doing, because you're hydrating, you're eating healthy, you're relaxing the muscles in the sauna, and you're actively kind of doing all the things you should be doing to recover from an intense workout. So I like to think about that, have a little bit of a balance. Go out, enjoy a couple of beverages with your friends, with your family, make memories, but keep your eye on the ball and go hop in the sauna, go get on the exercise bike, in the morning before you go out there. Hydrate and don't forget your fitness and your conditioning when you go out. Try to do a little bit each day to stay loose and to stay warm and to stay strong.
I know there's a lot of guests on this webinar today. I recognize some of the names. I know some of them are avid skiers. So if anyone wants to share a story in the chat or ask a question, please don't be shy. But Lynn, tell me a little bit about these pictures, number one. And also, have you experienced any spine or other joint pains in your winter sport history? And if so, what did you do to remedy that?
Well, yeah, first a little bit about the pictures. I was talking about the benefits of winter sports. And for me, the biggest benefit is just time with family, making memories with family. It can be an intergenerational thing. On the left, I'm out there with my 1-year-old son who's already got his own skis and boots. And we're just having a blast. And I'm teaching him all of this stuff. And my 4-year-old daughter, who's already got 20 plus ski days under her belt this year. Because my dad on the right there taught me all of this stuff when I was growing up. And so now we got 3 generations out there skiing all together. And they're some of the best memories I have. So I think these things are worth doing if you can do them safely. And I think most people can. It's worth the effort to consult the experts, prep yourself, figure out how to do these things safely so you can get out there and have fun and make memories for yourself and, ideally for the generations that follow after you.
I was reading somewhere the other day, getting your kids or people that you love involved in skiing actually is great because they will continue to want you to take them on vacation for the rest of their lives. So it's almost a guaranteed way to hang out with your kids forever.
That's absolutely right. I'm going skiing with my dad next week, and we're all looking forward to it. So it's a great excuse to get the family together and go, see beautiful places, around the country and all get out there together doing something.
So I'm a skier, but I did try snowboarding probably 15, 20 years ago for one day. And for the reason that you mentioned, I was on the ground the entire time. My wrists, my bottom, my knees, everything was hurting because you fall straight down. Versus with skiing, you can kind of control the fall to some extent and injure yourself less. But I did hurt my sacroiliac joint. I mean, that was a pretty common thing for me when I was skiing because it takes a lot of pressure on your glutes. Skiing is kind of a single leg activity. The down leg is stopping you from falling when you're going across the mountain. So some of the exercises that I really focus on, I was telling Lynn, I'm actually going skiing tomorrow. So if you're planning to see me as a patient tomorrow, sorry, I won't be here. But I've been really doing squats and lunges and getting my hips ready because I know going up and down the mountain is really going to be taxing on my hips. Have you experienced any injuries while skiing before?
I think I got a couple concussions, over the years, but thankfully, knock on wood, I've never broken any bones. I've never had any, ACL tears. I've never had a disc herniation. I was a rower, and we used to row in the winter, and I definitely tweaked my back and my neck a number of times doing that. But that's about the closest I've come. I think partially because I started doing this when I was 3 years old because of my dad there.
Yeah.
insisted we all learn. I think, that's one of the main things is just knowing what you're doing and knowing your limits, knowing where you're comfortable and where you're not, and using that knowledge to ward off injury.
How
How
much
about you?
I mean, other than my hips, luckily, knock on wood, I haven't broken anything. I always wear a helmet. But what's interesting is when I first went skiing, I think I was in 9th grade, so I didn't start very early. But I felt like no one wore helmets, 30 years ago. I just
Yeah,
felt like
that's
this is a
true.
newer phenomenon, which is great. I couldn't imagine skiing without a helmet.
I
But
didn't grow up skiing with a helmet. I probably
Right.
started when I was a teenager,
right,
but now it feels crazy not to have one on.
yeah, exactly. Let me ask you, what impact has minimally invasive and microsurgeries had on making patients recover faster so they can get back to activities, not necessarily related to skiing or winter sports, but in general? We've had patients I had a patient today who had a very large incision, open decompression and fusion. And nowadays you guys do things through the microscope. So what impact does that really have on patients getting better sooner?
A huge impact, huge impact. I mean, I recently had a patient, she had a big disc herniation. She was a 29-year-old girl, really active, big hiker, kayaker, did a lot of yoga. Hadn't been able to do that for 2 years because she had this nagging disc herniation that just was killing her. And nowadays we can do surgery through 7mm incisions. I use the endoscope. It's a little camera. We go down there. We barely drill any bone. Sometimes we don't have to do any drilling of bone. And we just pop the little disc out. And, I obviously ask patients to take it easy after spine surgery, but she was back in the gym 2 weeks later and just doing light core workouts, light yoga, all stuff that I kind of advised her on, and feeling better than she had in years after a spine surgery. So it definitely makes a big difference getting back to sports, getting back to life as you knew it before the problem you had started, and with way less, painful recovery or time to getting back to your normal self.
Yeah, and I think sparing the muscles and getting that structure back in line is also very important. And kind of what we talked about today, something called prehab. Getting the muscles prepared in advance of an activity are always helpful. A lot of times we see patients come in with lower back and neck injuries when there's a recent snowstorm. We haven't gotten a snowstorm in New York City in forever, but every once in a while someone goes from no shoveling to shoveling, and all of a sudden they get back pain and joint issues and shoulder neck pain because they weren't really ready for those activities. So just like what you were saying, really important to get your muscles geared up for any activity, whether it's skiing or spring tennis, things like that.
It's a lot easier to strengthen your muscles to prevent muscle spasms ahead of time than it is to try to get rid of the muscle spasms after they've started because you tried to do too much too soon.
All right, Andrew, thank you for being brave and sharing a comment with the rest of us. So Andrew asked, you mentioned skiing preparation worksheet. Could you show or talk about that more? Sounds like Andrew is skiing tomorrow. It's a little too late. Yes, you're right about one thing. It's a little too late to start exercising for skiing tomorrow. But nonetheless, what I'm basically talking about is things like this, things that you see in the mirrors, in the Zoom. So doing squats, doing lunges, stretching out the hip flexors and the hamstrings, as you see in this top picture. These are really great ways to get your body loose. And the biggest mistake I see people make is the first day especially, they wake up, they go get their rentals or their skis, they go get their lift ticket, they get on the lift and go straight to the top of the mountain and expect to do well. So the first thing to do is, while you're wearing the boots, try to get some stretching in, try to get the squats and the glutes activated. And then maybe for the first run, don't challenge yourself, just take it easy, get acclimated to the atmosphere and the oxygen levels, take a green or an easy slope all the way down, get your body warmed up, and then do something more aggressive. But specifically skiing exercises, I will have Roseanne or Jessica share some of the skiing handouts that we've given out in the past. But they're very good at getting your hips ready, very good at getting your core ready, which are probably the two biggest muscle groups involved in skiing.
Ricky, something I always say, you talked about at the beginning of the day. I always tell people at the end of the day, if you feel like it's getting to be your last run of the day, I would just quit right there. I think like 80% of ski injuries are on people's last run of the day.
Yeah.
And so I always try to stop 1 or 2 runs before I really feel like I need to quit. Because at the end of the day, you're not only are you tired, but everyone else is too. And so it's always the most dangerous time at the end of the day when everyone's getting ready to quit. Just avoid that whole mess by heading out a little bit early.
No, great advice. I totally agree. I'm going to use that this weekend when I go, but you're right. You know, when you get to the bottom and your quads and hips are burning a little bit, I think it's time. Don't be a hero and try to do one more run and rack up those feet climbed or whatever it's called on the Epic card. But yeah, quit while you're ahead. What else? Any more questions? I understand this is kind of a niche topic for us at Spine Time, but we thought it was timely. A lot of docs and patients are heading out for winter activities. But what you said at the beginning, I think is the most compelling, is winter sports doesn't mean skiing and snowboarding and tubing and skating. It's all the other walking-based activities that we probably don't stress enough, like snowshoeing, like hiking, like cross-country skiing, which is great for aerobic capacity. So don't be afraid to get involved in winter sports and not ski. There we go. We shared the exercises in the chat window for you, and you can download some of them from there. Any last words, Dr. McGrath, for our audience? Keep them safe during this winter season.
Get out there, have fun, be safe. If you have any questions, happy to talk to anyone. I consider myself an expert surgeon and an expert skier, so happy to try to combine those two. If anyone's got any questions about either, and have some fun talking about it with you all.
Super. Lynn, thank you for sharing your insight on this topic. I'm inspired by becoming a better skier and doing that safely. And thank you out there to everyone who joined us on this very unique Spine Time topic. Hopefully you got some information on it. We always appreciate you guys spending your Wednesday evenings with us. The next show will be coming up in 2 weeks. Topic is TBD. We'll let you know what that is. But until then, thank you from us at the Spine Time. We've got your back.